Hi, everyone. Glad you could join us. This is the first of our OHS lockdown lecture series. My name is Fang, and I'm one of the practitioners at Oriental Health Solutions. We miss you. We are doing this because our clinic is closed to in-person visits, but we're still here, and our patients are still here, and people are in touch with us, and we're continuing to see them just remotely. So lots of people have many questions about various things going on, some sort of ongoing health concerns, some more acute issues. And we thought, rather than answering each person's question one by one, it would be more fun and hopefully serve our community if we put together a series of talks on the most popular questions. So we hope they're useful for you. Every day I get multiple emails that start with the line, in these difficult times, or during these extraordinary circumstances. And I'm sure you get those emails too. And I don't deny that we are in extraordinary, difficult circumstances. I'm not telling you how to feel or what to do, but this is my way of trying to get through it, or having some perspective. Many spiritual or sort of wisdom traditions have the idea that all of life is a journey, all parts of it, and that we are currently in the moment, in the river of life, or the Tao, or the path, or whatever your tradition calls it. And I'm trying to keep that in mind. These difficult and extraordinary circumstances are a part of that river. And it's not to say that I don't have moments of darkness or worry. And I'm just saying that is my tool for keeping perspective. And I think before we get on with anything else that we talk about today, I just want to very, very clearly say that I am not talking about how to treat coronavirus or COVID-19 with Chinese medicine. And I'm saying this because there is some pretty strong censorship right now on the internet against anyone sort of talking about coronavirus or COVID-19 that is not in line with the official CDC recommendations. So I understand why that is happening. I think there's there are good and bad reasons for why that's happening. But as a result, because Chinese medicine, even with its many millennia of use, again, like for acute sickness, I am not saying anything specific about coronavirus. Instead, what I hope to give you is I hope to share a little bit on the history of Chinese medicine, sort of how it came to be used for acute and epidemic conditions, and sort of give you some examples of how Chinese medicine could be useful during a time like this. Here we go. Chinese medicine and epidemics, historical context, and clinical applications. I'm going to give you a Chinese medicine history rundown in 2 minutes or less. So this is going to be 2,000 to 5,000 years condensed. Chinese medicine is one of the world's oldest continually practiced medical systems. It's super old, like the mammoth. Some of our foundational texts are wicked old. The Yellow Emperor's internal canon was written about 2,200 years ago, maybe a little bit older. And this is the oldest complete medical text in the world. And this text is still holds the foundational principles that we use in clinic today. So, many of the acupuncture theories, really the basic ideas that we use for practice still come from this 2,200-year-old text. Another book that we hold dear is called The Discussion of Cold Damage. And this was written about 1,800 years ago. This is the oldest herbal textbook in the world. And, I'm sure some of you in this room, I have given you formulas that have come about from this text. So 2,200 years ago or longer, that was a long time ago. And what exactly was happening in those years? There was a lot of war. There was so much war that a whole period of 150 years was called the Warring States era. And unification of large parts of China happened sort of at the end of that period of the Warring States era by Emperor Qing, who he was the guy who kind of connected many segments of the Great Wall. So, this was the backdrop against which these textbooks came about. So I would like for people to understand that Chinese medicine is not, a medicine that was like derived from the sages who were on meditation retreats. Like, this is war medicine. It is acute emergency, I need to, save someone or rescue someone now sort of medicine. So then we fast forward about 1,500 years to the 16th and 17th centuries, where there were worldwide plague epidemics. Millions of people died. I just looked this up last night because I didn't know all the countries that it affected. But, Europe, the 13 colonies, China, India, many, many people were affected. And it was during this couple of hundred years when another very famous Chinese medicine school of thought came to be. And the febrile disease theory was the sort of school of practice, or a group of practitioners who formulated these ideas and clinical practice insights during these couple of hundred years. And again, some of you in this room may have taken the patent formula Yin Chao, so the Yin Chao tablets that we still use and still find amazingly helpful for early stages of what we would call a wen heat, meaning like when you're first getting sick, very sore throat, feverish feeling, sort of dry, uncomfortable throat. That's what that formula is good for. And it came about, it's been used since the 1600s. And then fast forward again, recently in 2002 to 2004, during the SARS epidemic, Chinese medicine was used by many people. And this was both, sort of as a cultural practice in people's homes, where people maybe used medicinal herbs as part of daily life or part of cooking, or in hospitals. In China, there are integrated Chinese medicine, Western medicine hospitals, or in like Chinese herbal clinics. And there were some really positive ideas and results that came out of those couple of years. There have been a lot of studies that have followed up on using Chinese medicine. And when I say Chinese medicine, often, during these epidemics, I mean Chinese herbal medicine, right? So Chinese medicine also includes like acupuncture or qigong or other methods, but most of these conditions are treated with Chinese herbal medicine. So there are a lot of studies on that, and one of the reviews of 130 studies show that positive effects using adjuvant herbal therapy included better control of fever, quicker clearance of chest infection, lesser consumption of steroids, and other symptoms relief. Some of the studies were more rigorous than others. So of course, like all review articles, it says that more clinical studies are indicated. So that was a promising thing that came out of a very recent epidemic. Okay, so that's, I think I took more than 2 minutes to go over 2,000 years. But onward. What is the goal of Chinese medicine? So, when you come in to see us, or when we try to treat someone, what are we trying to do? We're definitely not just trying to eradicate a virus. We're not just saying, this is a very sort of narrow view that we're taking, and we're just going to target this thing, and that's our goal. What our ultimate goal is to try to find health through balance, and we want to treat the individual. And what that means is, I need to look at the person in front of me, and I need to look at what health for that person might mean. Is it emotional health? Is it, are there digestive issues that need to be addressed? Yin, yang, qi, and blood, these are kind of more clinical signs that we assess. How is their breathing? What is happening with sensations in the chest? What is their exercise level like? So really we're looking at how do we find balance for this person. And then how does Chinese medicine view an illness that is part of an epidemic? Well, we are still doing the same thing. We're trying to find health through balance, and we also want to treat the individual. That does not change. What does change is that we want to consider each person's response, not only within their own body, but also to the pathogen. And also something else that changes, in my opinion, in an epidemic versus sort of in normal times, is the urgency with which we need to communicate with someone and to provide treatment. Often in our clinic, we see people for more chronic conditions, and that's an area where Chinese medicine or Oriental medicine really excels. So there's not as much of an urgency. Someone might wait a month before they come in and start getting treatment, because this is something that's been going on for 2 years, 10 years. But during an epidemic where someone may be getting sick and it may be very rapidly deteriorating, I might need to talk to them tonight, and follow up later tonight. And I think that is something that we need to pay attention to, and by doing that, then we can get better results. So, for example, in the case of someone being sick, we'll say, whether it's in an epidemic or not, but we'll say it's an acute sickness situation. We are trying to find health through balance by treating the individual. So, two people who are getting sick, we'll say in the last month, might have very different presentations. One person may have fever and a very sore throat and a lot of pain in the chest. Another person may have nausea and diarrhea and lack of fever and lack of thirst. And so these may be sort of, from a big umbrella perspective, the same virus or the same kind of fill in the blank biomedical condition, but how each individual presents is very different, and we have to follow each person's pattern and treat it as such. So I'd like to now do at least one case of someone who I just saw, and this is a good example of how Chinese medicine responds, and sort of the things that we look at, how we respond, and some of the things that we would hope to see with correct treatment. So this was someone who got in touch with me on April 3rd. I think this was on Friday. And she was concerned that after a very close-up interaction with the delivery person, this person had been in quarantine, social distancing. So she had an interaction with someone, and then she was not sure whether she was just nervous about this interaction or whether it was something else more real. But she just wanted to talk over that, her stomach area had pain and she was having increased bowel frequency, and the stools were softer than normal. There was more gas that she was having. She had a dry mouth and slight urge to vomit before belching, and also no appetite. And upon further questioning, she said that she had some chills but no fever. And also a very important question from a Chinese medicine perspective is, are you sweating or not? So she did not have sweating, but her skin was sort of sensitive to touch, and she just overall felt weak and shaky and sort of on edge, and she was concerned. And we actually, I spoke with her Friday night, and we decided that, wait until Saturday morning to see what was it, if she needed treatment. And the next day she still felt poorly. So I sort of analyze the case, and kind of the Chinese medicine language is that the surface of the body is closed and the digestive system was unbalanced, and therefore she was building up heat. So I gave her some herbs Saturday at noon, and when I checked in with her on Sunday, she reported that she was feeling 98% better. She said she had no more chills after the first dose of herbs, and I had given her instructions on how to sort of try to induce a slight sweat with that. And her stomach area was not sensitive anymore. The bowels were back to normal. The appetite had mostly returned, and her energy was much improved. So after that, then we kind of changed the herbal formula, and I gave her 3 more days of a different herbal formula to consolidate the treatment. And I hope that this gives you an idea of, what I'm trying to say that we can offer our community. I'm not saying that I'm like treating COVID, and this is just such an anxious time for people. What we are told is that, basically people feel like if they get sick, they have no options between getting sick and being really sick, whether it's coronavirus or something else. And I think that, of course, there are preventative things, like sort of common sense things that we should all do to take care of ourselves and take care of our health and protect ourselves. And, Chinese medicine is an amazing tool that is available and, potentially helpful for if someone is sick. And as with all like colds and flus and what we call sort of external pathogens, the quicker that we are able to address something, the better. So I have told many of my patients this, and just because we are not in the clinic anymore doesn't mean we are off duty. And I hope that you understand that we are here, and we want to be people who can help alleviate some of your anxiety about, what if I am sick? In summary, I'd like for you to take home from this little talk that Chinese medicine originated with treating acute conditions. So this is a medicine that is effective and useful for acute conditions. Branches of Chinese medicine developed from epidemics throughout history, and Chinese medicine, when applied correctly for the individual, can help to manage a whole variety of issues, such as fever, chills, cough, breathing difficulty, body aches, nausea, diarrhea, constipation, and many other manifestations of being sick, these kind of acute being sick feelings. And that is something that's, Chinese medicine was born out of treating these things, and is still an ongoing medical system that is being used for these conditions. We hope you know that we, as your community clinic, we are here for you, and that you can reach out to us in your time of need. I hope that everyone stays healthy and well, and we will see you on better days.